counterparts, the most important Ministry of Health. When we were approached by Honourable Minister to support isolated communities in the north and in the east, we were very pleased to do this. As you know, the vaccination campaign in Sri Lanka has been exemplary. It's been highlighted not just by WHO, but globally. There's been rapid expansion. We now are at about 56% coverage of the total population. Now, understandably, initially, the campaign had to be in the areas where transmission was high and where cases and deaths were high as well. The isolated communities have been able to stay safe, but as you know, one of the key variants, that is the Delta variant, really transmits very rapidly, and it has a shorter incubation period. So with the Minister, we were quite keen from WHO to partner the Ministry of Health to ensure that these communities were very rapidly covered with the vaccination drive as well. And we're very pleased to see that we have about 90% coverage now in these communities as well. What was a little bit of a concern was possible vaccine hesitancy, and we're glad to see that the community uptake has been very good as well. And I would like to reinforce from WHO that all WHO-approved vaccines are absolutely safe. They provide good protection against severe COVID-19 disease, hospitalization, and deaths. It's perfectly safe to take if you're pregnant. It's particularly important for those over 60, those with comorbidities, even children above 12 who have comorbidities. WHO is now advising be vaccinated because they are more susceptible to COVID-19 severe cases. We've also seen, and I'd like to highlight to you, the impact of the government's very, very stringent measures through the quarantine lockdown. Now, these were very strategic, and we must applaud the government for taking this bold step. It's brought down both cases and deaths very dramatically. We've seen that. We all understand the constraints of the lockdown, the constraints of the quarantine curfew, but we have seen the incredible impact on both cases as well as deaths. Now, the quarantine measure was really from the government side. And what I'd like to highlight today really is all of our individual responsibilities, which is for us to make sure that we follow social measures and we follow distancing, wearing masks, the 3 C's, avoid 3 C's, crowded places, confined spaces, and close contact. That's our responsibility. As Sri Lanka really moves to the next phase where we have high levels of vaccination that will prevent us from severe infections and deaths, we each need to take up our own responsibilities and make sure that we contribute to this effort to fight COVID-19. Finally, as the lockdown is eased even further and schools are reopened, I would like to, and I must reassure parents that it's perfectly safe to send your children. I believe the primary sections will be opened. It's safe to send your children to school. The global evidence suggests that the schools really reflect what's happening in the communities. It's not as though the schools have higher transmission. So it's safe. The government is moving forward in a step-by-step manner. It's ensuring that the schools are safe, including public health and social measures. So the government is doing its best to take care of your children. So please don't hesitate. Of course, the schools need to work with parents and communities to ensure continued safety. And please do work together to make sure that we can get back to a normal life. But please remember, it's not just about vaccinations. We have to do it all. Social measures, wearing masks, being safe, please, that would be WHO's appeal to everybody moving forward. Thank you.